I wanted to share some information about ocular findings that are possible and often present in patients with dementia and Alzheimer's disease. We see cataracts at various stages. We see folks that have had cataract surgery with lens implants, and then we see folks that have had lens implants and have a membrane that's come along behind there that may need to have a laser capsulotomy that needs to be taken care of. That is a fairly simple procedure that can be done in the office with their primary care optometrist or ophthalmologist. A lot of times we find macular degeneration, and the vascular findings in the macula may be a predetermining factor on some of the circulation and brain chemistry. So if there are small retinal hemorrhages, there may be small hemorrhages in the brain. With Parkinson's disease, we may see some relationships with glaucoma and some relationships with field loss. And patients may have wet or dry macular degeneration. That may precede the brain changes, and that may be one of the clues that we can have for early detection. Glaucoma may be prevalent, and with patients that have been living alone, getting their eye drops in a timely manner or remembering to do their eye drops at all, that situation may improve, and we may notice better management, better glaucoma control when a patient moves from personal living situation to an assisted living or a long-term care situation. So looking at how glaucoma makes progress over time, you want that patient to have the maximum visual field as long as they possibly can for help with mobility and navigation. Visual fields may also change from a stroke. So if a patient has had a stroke, they may have trouble seeing one side of midline to the other. And they may have good visual acuity, but not have the contrast or the spatial awareness that they need to navigate throughout their home or throughout their daily living situation. We do also encounter hallucinations. It may be something in the category of Charles Bonnet, where the person sees flowers or sees rain or sees something realistic that they know is not accurate, or they may see ants or other things that they're certain are absolutely there, and they won't move forward till you acknowledge some things. This kind of compares to the ghost pains that someone who's had a foot or a leg amputated may still feel pain in the foot that's not there. So the brain death and the visual changes, that may show up with similar descriptions. Thank you very much. I'm glad that you tuned in. If you like this information, stay tuned for more. Thank you.